Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have a very special guest, Dr. Praveen Rajesh. He, with his exceptional excellence in his subject, is here to discuss how did he reach to the excellence he's there. He has cleared his Royal College of Surgeons examination, and so he's one and the only dentist who has cleared the examination and is residing in India. So let us understand his journey. How did he understand to give this examination? How is it helping him in his practice? Why is he in India still and not planning to go outside? And n number of questions. So, and if you have any questions, do let us know. We will definitely ask those as well. Welcome, doctor, to the platform. It's really nice to have you here.
Thank you, Dr. Ayushi, for that wonderful introduction.
Yes. So, let's start a brief about your journey. How did it go till now? And, you have a lot of things in your bag. So let's start from the start.
So just if you want a brief about myself, I completed my undergraduation in 2010 from Bangalore, Karnataka. I did it from RGHS University. Well, I went into this field. Like a lot of people ask, why do you do dentistry? It's like most people, it was like, because I didn't get medicine, so I took this up because I had a strong passion for life sciences. So it was my own decision. I was not pushed into it. So I took full responsibility for my decision, and I really enjoyed my BDS days. It was wonderful. And after that, I wanted to do specialization. I was probably the first guy in my college. In my college, specialization was not very popular in 2008, 9, 10, and also. I was one of the first guys to get through the, I think, the Karnataka CET, which was the government conducted CET, and I got the 29th rank in my first attempt, and got into Bapuji Dental College, which is again affiliated to Rajiv Gandhi University.
Right.
And completed my PG in 2014. And after that, I consulted in many different clinics as a consultant endodontist. Like most MDS faculty do this, they go to other clinics as a consultant. And I was quite happy for the first 1 year. Then I felt, where I'm doing the same thing again and again. It's the same routine. It's kind of getting boring after a while, and it is kind of exhausting to run to three to four different clinics every day. So I wanted to well, right from my childhood, I was I grew up looking at my uncles who were again doctors, and they always used to tell about the Royal College and all those things. So I always was fascinated. I wanted to know, can a dentist actually do something with the Royal College? That FRCS, MRCS, and all. So at one, so I did a little bit of searching, and I found that there's quite a lot of examinations and affiliations we can do with the Royal College as a dentist as well. And I think most of us know about MFDS, the membership in Faculty of Dental Surgeons of Royal College of Surgeons, and that you can do it after your BDS. Now I thought, okay, instead of doing this, I've already done my MDS. I'm a specialist. I'm a root canal specialist. Why can't I do something related to my specialty? And when I probed further, then found the MRD exams. So that time there was something called the MRD. It stood for Membership in Restorative Dentistry. So membership in restorative dentistry sounded very vague, because there was membership in orthodontics, membership in oral and maxillofacial surgery, MOMFS. However, there was nothing for membership in endodontics or prosthodontics or periodontics. It was combined, and this was called membership in restorative dentistry. So we had to prepare in all the three specialties to a good extent. What you were not taught in your UG, you had to learn all that to actually give this exam. So it was in addition to my endo part that I had to learn these two specialties. So it was quite it looked like a big challenge for me, and I didn't have anyone to ask also, how to go about this in India, because to my knowledge, I think I had one of my profs had attempted this, but he didn't clear, and he guided me a bit, but he didn't know it. He didn't know much about it himself. So we didn't have. I mean, I basically didn't have any guidance. So I started looking at in Facebook and Insta to see if anybody has cleared this exam. So that was the time I found a doctor in Middle East who had cleared this, and he had put some posts regarding it. So I did contact him. He gave me a brief idea on how to prepare, and by what he said, I felt my clinical routine now is not adequate to prepare for the exam, because we had to present 4 cases, and we had to prepare them in an international format. It was quite difficult. So then I decided to move to an institute which will let me prepare my cases and prepare for the exam. So we took a big decision that time, and we moved to Pondicherry in 2016. I'm sorry, in 2015. And then I prepared for a year. I was like a little half prepared, because you move to a new city, then there are new challenges and stuff. So it took like 2 years for me to overcome and prepare my cases and all. And by 2017, I gave my first attempt, and I didn't clear that. And in 2018, I was able to clear my exam. So this is how it
That's great.
panned out.
Very nice to know that. How did you plan everything? So for our viewers, firstly, to understand what exactly is Royal College of Surgeons, where is it? Why is it so esteemed? Why is it so well known? And how does it make a difference? So if you want to explain a bit.
Right. So brief history about Royal College. So it's there in their website. So basically, in 1400s, in 1400 AD, people started, before 1400, it was all crude and black magic and all those things were going on in Europe. Sorry about that. So, from 1400s, people started scientific thinking. So that's when people like Andre Vesalius and Ambrose Paré. Vesalius is the father of anatomy, right? I mean,
yes.
the ancient anatomy.
Yes.
So people like him started documenting an amazing literature on the human body, and it became very popular. Medical sciences started becoming very popular that time, and people who practiced medical sciences or surgery that time were barbers mainly. Barbers and surgeons were almost the same. So they used to do lancetting, bloodletting, even shaving, and everything were done under the same roof. And it was done in a non-standardized manner. So like we know, the Europeans love to standardize things. They want things to go in a proper order. They don't like it otherwise, not like other nations. Correct. So they started the incorporation of surgeons and barbers. So that was the first medical institute in the entire world. And that later on converted itself into the Royal College of Surgeons of Edinburgh in 1505. And in 1540, they established the Royal College of Surgeons in England. And then in 1600s, Glasgow was started. And in 1700, Royal College of Surgeons of Ireland was started. Okay. So basically, these are very old, around 300 to 500-year-old institutes. And what they currently do is they conduct a lot of training programs and workshops for the institutes in the European countries. Okay. Because they have the faculty of the most well-known surgeons and all in their country. So they do training programs. They supervise the training programs in the institutes. Like all the other universities, University of Manchester, University of Birmingham, all these are monitored by the Royal College. And they also have, I think they also have some, and finally they have examinations. Basically, most of the specialty programs have their endpoint exam conducted by the Royal College. Say, for example, if you're an ophthalmologist, you will complete 3 years of training in ophthalmology there in your college. But then the end exams will be taken up, you will have to take up in the Royal College. It's something like the board exams, like how the Americans have, no? The
yes.
Yeah, American board. So very similar to that.
Okay.
And in addition to that, they promote dental research. They also are an advisory body to the Department of Health for the government. And they collaborate with other medical organizations around the world, like especially they're popular in Canada and Australia as well. And of course, they're popular in most of the Asian countries and in Middle East as well. So what they don't do is, so this is very important. What they do not give you a direct license to practice in any country. So none of the royal surgeons, even if you give their exam, you can't directly practice in a country, except for one exam, which we'll talk about it in later. And they don't directly involve patients or guide the patients to the specialist and all this. So they don't do any patient related activities. So the only way you can become a part of the Royal College is through examinations.
Okay. So now when you tell me a part of the Royal College is through the examination. So now what I understand is that you are a part of the Royal College of Surgeons. So what are the advantages attached to it? Because when you tell me that they do not allow you to practice or license, is something which is the main part that people, try to do examinations internationally so that they can practice in that place, they can settle down. So then what is the advantage of giving this examination? Why did you plan to give that?
Right. Okay. So if you're talking about a BDS, let's talk about dentistry alone. So if we are a BDS graduate, there's only one examination. There are actually two examinations. One is the membership in MFDS, the Faculty of Dental Surgeons, and MJDF, Joint Dental Faculty, it's called. So you can either give these exams. Now, the advantage of clearing these exams is you have a better chance of getting a post-graduation seat in the UK or in any European country. If you're planning to do a post-graduation there, MFDS is almost mandatory for international students. If you want to get a good seat, that's one thing. Second is if at all you clear your licensing exam, which is called the ORE, Overseas Registration Exam. If you clear that, and if you have MFDS, you'll be posted in a better place, because MFDS gives an idea to the world that you are willing to learn, you have the potential, you have a good clinical skill, which is probably better than the competition, and you have your BDS training in India is equal to international standards. So it establishes that fact. But still, like you said, ORE is still mandatory. And if there's the same thing for specialties also, right, that even if you do MDS in India, it's not recognized in the UK. You'll probably have to do prosto surgery ortho over again. So the M.endo or the M.prosto or the M.ortho gives you the opportunity to be recognized as a specialist in the UK directly. So that's the main advantage.
Okay. But apart from this, as a specialist, like you are a specialist, you have done your MDS and then you gave the examination. You don't have any other advantage except being preferred as a better candidate if you go internationally. What I understand. So does these kind of examination also help you in different countries apart from UK, for example, UAE or US or anywhere? Does it help?
Yes, it does, especially in the Middle East countries, UAE, Kuwait, Oman. Almost all the countries recognize their degrees. There's no doubt about it. In fact, one is, the competition right now for Middle East jobs. People for one job, I've heard from my friend who settled in Dubai that she had like 10 candidates along with her for a simple BDS post. And so the competition is there. So if she had MFDS, she would have easily been picked, and you can cut through your competition in Middle East. And Malaysia, to be a faculty, it's almost mandatory for you to have a Royal College degree. And Singapore as well recognize it to an extent. Hong Kong, in fact, is a center itself for the Royal College exams. Malaysia also is becoming a center now for the specialty exams. In fact, the Hong Kong University has a direct tie-up with the Royal College Edinburgh. So all the Hong Kong graduates have to go through the Royal College exam.
Okay.
Also, it's recognized a bit in Canada and Australia also to probably help you in certain steps in their exams.
But you have to give the licensing examination is what?
Yeah, every country you have to give your licensing exam. They don't give you a direct pass to practice. You need to do it, yeah.
Okay. So now when you mention, one more thing I wanted to ask, previously you mentioned that these Royal College of Surgeons does not deal with patients.
Yeah.
What exactly do you mean by that? So when you do examinations, don't you work on patients? What do you mean by this?
So Royal College, most of their exams are, all their exams are on typhos, dummies, or OSCE stations, right? Okay. So they don't involve patients. In fact, the Royal College of Surgeons of Edinburgh doesn't have a teaching wing or where they have patients and trains graduates. It's mainly an administrative body, basically. And they have exam centers. That's all. So they don't. It's not like IDA that they do some patient information rallies, campaigns. So they don't do anything related to patient. They're completely focused on the surgeons and the doctors. Yeah.
Okay. Nice to know. So now when we have talked about the Royal College of Surgeons in depth, understanding about this examination, you have mentioned two types of, the two kinds of examinations in this for the BDS graduates. What are there for the specialists? For example, you did M.endo, what I understood.
Right.
So what are these kinds of examinations for the specialists as well as for the BDS graduate, if we can repeat, for them to understand if whatever stage you are, what you can opt for?
So the good thing about them is that there is an examination for every stage. There's an examination just after your BDS. You can give it during your internship as well. And there's an exam if you've done your BDS and you've done a diploma course. So nowadays, these 1 year, 2 year diplomas are pretty popular, no?
Yes.
So there is a diploma affiliation as well. And there is after MDS, you can basically 3 years. So they don't ask you to have a MDS. They want you to have a 36-month training in your specialty, right?
Okay.
So, so for the BDS, in fact, you have 3 exams. One is the MFDS, or the Membership of Faculty of Dental Surgery. And the other is the Membership of Joint Dental Faculties, MJDF. So both of them are equally good. Probably MJDF is a little more academic. So if you're looking to join a college to do your post-graduation in the UK, MJDF may be better. Then you have the Membership in Advanced General Dental Surgery, MAGDS, RCS. So this can be given only 5 years after your BDS. After you have good clinical knowledge, you can give this. It's a little tough exam. Again, but the value is it's still almost like MFDS itself. If you're planning to apply for a clinical post abroad, this has a good value.
Okay.
Then you have 3 affiliations for BDS with a diploma. So if you have a diploma in orthodontic therapy, you can give an exam called the Diploma in Orthodontic Therapy, Royal College of Surgeons. If you have a diploma in implant dentistry, you can give the Diplomate in Implant Dentistry of Royal College of Surgeons. It's called DIP Imp Dent. And then you also have, if you have a diploma in special care dentistry, it's not very popular in India, but I think other countries, they have special care dentistry. So basically, special children and pediatric dentistry. So there is the Diplomate in Special Care Dentistry of the Royal College of Surgeons of Edinburgh. So these are the 3 you have for diploma holders.
And
yeah,
when it
BDS,
comes to specialists, the MDS, are there for all the specializations?
Yeah. For all the clinical specialties you have for in fact, for I think, for surgery and orthodontics, you have the tricollegiate exam, which means all the 3 royal colleges, the Edinburgh, England, and Glasgow, they conduct these exams together so that's called Membership in Oral Surgery, or the Membership in Orthodontics, M.ortho or M.surgery. For the other specialties, it's either a single college exam or a bi-collegiate exam. sorry, even for pediatric dentistry, you have a tricollegiate exam. So membership in pediatric dentistry, orthodontics, and surgery is conducted by all the 3 colleges together. Till 2016, all the Royal Colleges conducted, apart from these 3 exams, they only conducted the membership in restorative dentistry. But from 2016, they have split restorative dentistry into membership in endodontics, prosthodontics, and periodontics, which is good news for us because we in India are specialized only in one field, right? So therefore 80% of the exam will be on your specialty. The 20% will be on restorative dentistry. So so I think we have 7 different exams now: surgery, ortho, pedo, endo, prosto, perio, and also special care dentistry. Okay, so I think for community and oral path, they don't have an exam, to my knowledge. I'm not very sure.
Okay. So now when understanding all of this examination for BDS as well as MDS, is it that clearing these examinations help them get a faculty seat in teaching? Does it help in that?
You're talking about India?
No, in UK itself, for example, because it's a UK examination, or in any other part of the country, because I understand that you cannot practice as a license. You don't get it.
So I spoke regarding this to a professor in the Hong Kong, Nigel King, and because Hong Kong people do recognize this.
Yes.
So according to him, this is not the only thing that they look for. This is one of the criteria for you to join as a faculty. It's not that easy to get into the Hong Kong University. But this will definitely help you. But provided there should be a vacant seat and you should be doing research in an area where the university is interested. So probably I'm guessing even for UK, it's going to be something similar because I've not contacted anyone regarding a faculty position in the UK. But what this exam will give you is a position in the specialist register. So in the UK, there's something called specialist register, where you need to complete the Royal College end specialty exam. So these are called end specialty exam, the MORT, MOMFS, M.endo, M.prosto. All these are called the end specialty. Basically, there's nothing else you can do after this. This is the end in their training. So if you're completed your training, you can put yourself in the specialist register.
Correct.
So that's something that they guarantee. But getting a faculty position again depends on a lot of things: vacancies, your area of research, and of course maybe they prefer PhD people and all.
Yes.
So directly getting a faculty job just with this, it's not guaranteed.
It's not guaranteed. Correct. So now let's understand in detail your examination that you prepared for M.endo. What is the kind of procedure and what did you what exactly is there inside it? What is the procedure of that examination, and how did you and things related to that? First, let's discuss about the procedure of the exam.
Okay, first we'll talk about the application, how to apply for it.
Okay, done.
Okay, so initially when I applied, they didn't have a set system to recognize Indian students for this exam. So they asked for our logbooks, they asked for our PG curriculum, they asked for our DCI curriculum and all. And they had to analyze it with their committee. Their committee is called the I think Specialist Advisory Committee. They every 6 months they have a meeting and they go through your records. So I submitted it like in 2015 end or something, and they got back to me after 3 to 4 months in 2016, and they said, yeah, you can give the exam. And so after they gave me the green light, so I had to give, after analyzing my records, I was allowed to apply online. So the entire thing is online.
Okay.
So you need to, in their website, in the Royal College of Surgeons Edinburgh website, you have this application process, very, very basic application. They only ask for your basic details and your qualification. They don't even ask for your, once the Specialist Advisory Committee has approved your documents, they give you a registration number. I mean, some user number or something, and a password to get into their website. So once you get that, you can directly apply for the exam. But you need to, you need to pay the exam fee when you're applying for it. After you pay the exam fee, they'll ask you to submit the cases. We had to submit 4 different cases, and they give you around 1 month time for that. So the application usually opens around 8 to 9 months before the exam. So usually the exam is conducted, the specialty exams, they're conducted twice a year.
Okay.
Once in September in UK, and the other will be in November in the Middle East, usually Dubai. And you need to apply before, I think, July for the November exam, and before May or April for the September exam.
Okay.
And so once they confirm your seat for the exam, they'll send you a hall ticket out. So it's a very simple process. So now you don't even have to send your work done or your logbooks and all. Now they have now they recognize Indian MDS degrees. Okay. And you just have to send the transcript of your degree certificate. Okay. And your registration, probably they'll ask, and that should be it. They will let you give your exam. They'll give you a unique code which you need to use it to enter the website, and you can do it.
So you mail this to them, or you do this also through your website?
Mail. We have to mail all this.
Okay, and all the details of mailing are there on their website?
Yeah. There's an examinations in charge. So usually all communication with the Royal College goes through mail. You can call them directly, but it's better it goes through mail.
Okay. Glad to understand. Now, when you were talking about fees, how much is it for?
The specialty exams, the prosto, perio, endo exams are for around £1,500, which is like 1.5 lakhs. And I think, I'm not sure about MFDS. I think the first MFDS happens in 2 parts, part A and B. I think the first part is around 30,000-40,000. The second part will be around 80,000 or so. So roughly any exam you give will cost you between 1 to 1.5 lakhs.
Okay. So now let's discuss the procedure and what percentage of people actually clear this examination. How does it go? Okay. How difficult it is? So something on those lines.
So the exam pattern per se, for us, for the endo, prosto, and perio, it goes like this. Currently, so when I gave, we had a 3-day exam. First day will be theory. Second day will be case presentation. We'll have to present our 4 cases, and then we'll have a viva. And the last day we'll have unseen case discussion. They'll give you some case records. You need to examine it for 15-20 minutes, and then you need to give a viva regarding those cases for half an hour. Now they've changed the rules. You don't have to present cases. So that's a big plus point for people who want to give now. So you don't need to sit and prepare cases. Rather, you need to sit and study more. So right now the exam pattern is like, first day you have 2 theory papers. Second day you have theory papers is MSA, multiple short answers, something like short notes, what we write. Second day will be the long cases of long unseen cases. So they'll give you around 15 minutes to examine case records. They'll give you mostly photographs, maybe sometimes models will be kept. You need to analyze, you need to do a treatment plan in your mind, and then they'll ask you questions regarding it. The third day will be short unseen cases, where they'll give you around 7.5 minutes per examiner. You'll be going to different examiners. There'll be different, like OSCE centers, and they'll show you some records, and they won't give you time to prepare. They'll expect you to immediately answer. So something like spotters, how we have in India.
Yes.
So this is a pattern right now. So if you see the pass percentage for, so it usually depends where your training is. Most of the UK graduates give the September Edinburgh exam. So there the pass percentage is around 70-80%, which is quite good. And if you're giving the Dubai exam, usually the international students give that. Mostly Indians, Egyptians, Middle East people give it. And there the pass percentage is quite less, around 25% only.
Okay, there's a lot of difference.
So yeah, just 1 out of 4 people actually pass these exams.
It's maybe the way they see dentistry or practicing medicine in a very different way than.
Yeah, it's because they have an evidence-based approach and a guidelines-based approach. They expect you to adhere to it strictly. So in India, unfortunately, as we finish BDS or MDS, we go into private practice. we change everything according to the patient's convenience or our convenience.
Correct.
And we cut corners, and then our thinking itself changes to that way. We don't think of, say, for example, if you're going to do, you're planning to do an open apex treatment. The literature currently has 3 different treatment options. You can do long-term calcium hydroxide placement. You can do a single visit MTA placement and complete it, or you can do revascularization. Now, how are you going to choose between these 3 treatments? You can do either. None of them are going to do any harm to the patient, but you need to choose the best treatment for that particular patient based on evidence. So there is a systematic review done in 2016 by Monty Dugal, and that is taken up by the European Academy of Pediatric Dentistry as a guideline for managing open apex cases. So you need to quote this reference and tell them, so according to the European guidelines currently, I would choose the single visit MTA apexification. One, because of that. Second, this case is doesn't have such weak dentinal walls, maybe. So you need to also justify logically. You need to give a logical justification, and you need to give an evidence-based justification. So we are not trained that way, unfortunately.
Correct. So now when we discuss this, that we are not trained this way, and still clearing the examination needs some kind of preparation. So how did you do that staying in India? Because if maybe UK people are exposed to this, if you're there in that environment, maybe you get some people to guide you or to train you. How did you do that here, staying in India in Pondicherry, to prepare for the examinations?
So, so what I initially did was, first I went through our standard textbooks for the basic references. And so I made notes of, I took every topic from the textbook, and I made I made a master article, master notes, where for every topic like outcomes in endodontics or access preparation, I had around 5 to 10 references for each topic. And the important stuff, certain topics will require 20, 30 references. So I made a entire, almost a book full of my notes. So this helped during the Viva. The second is, I asked some of my, the doctor who gave there. So he gave me a brief idea on how to prepare, but in my first attempt, I realized that is not enough. Then after my first attempt, the biggest help came for me through the friends who actually cleared the exam. Okay, so they knew how to do it, right? So those guys, they taught me how to go about the exam. So they in fact shared a lot of secrets and insights on how to prepare, and they gave me some previous question papers and stuff. And so you basically need those previous question papers, you need guidance to do this. So then I refined my preparation, and I had to study more of the British related articles. They have the British Dental Journal, right, which is very important. You need to read it so that you understand their way of thinking. And there are specific books which you need to read before giving. And so my preparation went more towards the British style than the second attempt. And also I did some mock exams with, I self mock basically. I asked my wife to set the exam paper, and then in fact I also asked my colleagues to ask me some questions in Viva. And since I was in a college, I was able to I was in charge of the journal clubs there, so I asked my postgraduate students to present stuff which was helpful for me. So some landmark articles and stuff. So kept doing that. I think that helped me the most.
Correct. No, that's true. That actually helps. So now when understanding this, and so what I understand that you self-studied only. Did you join any kind of trainings or?
So that time there was only one training in, there was an Egyptian group of people who were because in this exam is very popular in Egypt. So in Egypt they had a training center, but they were quite expensive. They they charged around 3,000 to 4,000 US dollars, around 2-3 lakhs. So I couldn't really afford that. So I like, let me give an attempt itself. Let's see how it goes. And I didn't join the training there. So what we have realized that, training is so important. It probably decides whether you pass or not. So we've started a small training here in India itself at very affordable costs for people who are interested. So we just started it last year. So it's going on all right.
Okay. So you're helping students who actually want to clear now.
Correct.
Okay, great. So this is a short message. If you are interested and want guidance, or if you're not clear, you can actually connect with him. So now, understanding this more in depth, we have discussed how are the exam procedure, how to prepare, and now also we have discussed what are the advantages of giving these examinations. So what now, after doing all of this, you are settled here in India. And what I understand, some of the people actually plan to go out after clearing this examination because it gives a path for you to go out.
Right.
So what was your idea to staying back in India, and how is it helping you here in your practice?
Okay, that's a great question. Difficult to answer because I myself wanted to move abroad initially. So when our plan was to go to Pondicherry, prepare for 2 years, give the exam, clear it, and then move to Middle East or UK, or wherever is more easier. And during that time, I also worked as a consultant. I kept working as a consultant in clinics, and I developed a sense of understanding that practicing this type of dentistry is I'm not doing justice for people. So right, as a consultant, we can't do much of a justice, at least in endo. I can't really give my 100%. I know I can do cases in a much better way with rubber dam, doing all the 3D irrigation and using microscope. There is a huge potential for that over here, but we were not expressing that, and I was not feeling fulfilled. So that was seen in my cases, because every week I used to get a case where I couldn't give the best treatment. Like, for example, broken instrument or a very difficult retreatment, I couldn't do it the best way. So then I realized that we should open a clinic where we do that international level international level treatment for the patient, give the best possible treatment, sterilization way, best possible sterilization, best possible procedures under microscope. So all these pushed me to establish a clinic in India. So I really felt India needed that. There is, although we say we are economically backward, we're not. We are still developing. Maybe patients cannot afford this kind of treatment. We can make it affordable. So we believe in affordable international care, and so we opened a clinic called Microsmiles in Chennai, and we are trying to do that here. And I felt after going to I went to Middle East 3 times, and I went to around 3 to 4 different clinics, and I observed them, and I in fact went for a few interviews as well to those clinics. And there I realized that they do have a good set of sterilization protocols, infrastructure. They're giving the best possible treatment to the patients, which I could think of. So I was like, how could I can't give that that special edge to them, that because they already have that special edge. So I felt Indian patients needed that edge. So that was the main reason why we stayed back. Okay, basically we wanted to provide good quality dentistry. And it's not like my M.endo was not utilized. Even here, I see many patients come to my clinic. I just have my certificate hanging in my clinic. So they do ask, okay, doctor, you've studied there, so you've got a degree from there. That's great. Maybe I'm in a city, maybe patients can recognize, but still patients do see that. They do see your qualifications. They feel a sense of confidence in the doctor if they look at degrees like this. So it is definitely useful. And colleges, good colleges in India do recognize these degrees, and they do give you a preference over your. So now we know that if you want to join a college, there'll be at least 10-15 applicants for the same post.
Yes.
If you have a degree from the UK, obviously you will have a edge. Of course, if it's an unbiased interview, you will definitely get through it. Good colleges like, in fact, like Savita do offer good, they do recognize these kind of things. I think even in North, I think DY Patil and many good colleges are there, which will definitely recognize it. So in India, the degree per se has very, only people who value it will, look at it in a high, will give a high regard for it. Apart from this, in India, the process of examination itself changes your way of thinking. Okay, so that is the main advantage of this exam. So nowadays, when I look at my patients, I look at them in a more holistic way. I don't just look at a single tooth and do endo. I'm sure that's the same thing even with my prosto colleagues and perio colleagues. They look at it in a holistic way, and they feel like giving the guidelines treatment. They don't want to just give what is easy or what is the norm in their place. And I've started seeing things differently, to be honest. And I also look at the other treatment options now. Before, I used to be like, I'm comfortable with calcium hydroxide, I'll only do calcium hydroxide asphyxiation. But we were looking at other treatment options. Okay, revascularization is possible in this case. It's not a bad treatment option we can consider. So, and we also give the patient proper prognostic rates, because for this exam we need to learn about prognosis. We also tell the patient, so if we do this, you get 95% prognosis, you do this 70%. So patients are also able to take a more informed decision because we have that knowledge to give them.
Yeah. Correct. That's true. That's true. So Dr. Veenu Subramaniam is asking, will Royal College provide mentorship to appear for M.endo?
No, they do not provide direct mentorships.
Okay. Okay. And is it possible to get previous question papers from anywhere?
Not really. It's only through friends and through social contacts that you can get. So we have got it all through our friends in the UK and Middle East. So we have from 2014 we have almost all the papers, prosto, perio, and endo.
Okay, so Dr. Veenu, you know who to connect with. So just I will let you know how to connect with him. He will definitely help you with the papers if you're really trying to give the examinations. So now, understanding this, what I understand in UK, is it legal to give all these question papers? Because I have had this discussion previously also, because UK in general do not allow. They don't allow passing on the question papers. So just wanted to understand that.
So in fact, the exam is conducted in such a way that you write the answers in the question paper. So you obviously have to submit it. So you don't take even one small bit of paper back home.
Yes.
So the entire question bank that has been prepared for us is from memory. Okay. Very similar to AIMS. Of course, AIMS also it's illegal for you to leak the answers, but then we have a question bank on AIMS.
Yes.
Questions, right? So very similar to that, just based on knowledge, people pass on the information.
Correct. So, now lastly, after understanding everything, I want to understand anything from your end for the dentists who are still in that, in that not so clear zone, that should I prepare, should I not prepare, helping them understand how this examination can help and how they can make up their minds.
Should you give or not give? That's a question that you need to answer for yourself. The question you need to really answer is, do you want to progress in your career or do you want to stay stagnant? See, there are a lot of things you can do in your profession. You can do CD programs, you can attend short-term courses, but they all don't give you that recognition that an international degree would give you. To be frank, there are so many courses in India for endo, for perio, prosto, whatever it is. they help you. They'll help you definitely clinically, but you cannot tell this to someone outside your area. You can't tell this to a non-dentist, or you. Now, if I tell this to a non-dentist, also they do recognize, okay, a Royal College, FRCS, MRCS, they can relate with you. They're like, okay, doctor has done
Medicine
this.
will do. Yes.
Yeah. Now, if I tell I underwent microscope training in the best institute in India, they'll ask you, what is microscope? So why does a dentist need a microscope? So, but FRCs, MRCs has that weightage, and so yeah. You have, if you feel you need a recognition, to one is for your own self-confidence. So I'm a person who never had self-confidence. Okay, I'm very bad with it. Even if I get the best paper, I'll feel, okay, yeah, I'm a good dentist. Okay, for 1 or 2 weeks I'll feel good, then I'm again like, can I cut through the competition? Will patients come to me? Will I get a college job? So all these things used to tear me apart when I was younger, and I always lacked confidence. So maybe that was one of the things which pushed me to give this exam, even when nobody had ventured into it. So now we have people who are venturing into this.
Yes.
So even if you think of giving it now, you will be one of the first pioneers who have ventured and got this exam cleared, right? So always you have this pioneer advantage in any area. So I think this is a great time for you to give the exam, and it will help you in your careers in some way or the other. It will help.
Great. So now understanding, now when you mentioned about confidence, so what is it that keeps you going with your confidence and your motivation always, and has been with you, something that you want to share with us as in general?
What is keeping me going right now is like people like you guys who actually think I've done something different, because I still think I've not done anything great, but you guys give me that confidence and help me try to improve myself day in and day out. So you guys really help me a lot, and probably social media, when I post my cases and post things, it really gives me a lot of boost in the confidence. That's one thing. And of course, my family and my wife, she's kind of like the pillar who, in fact, to be honest, I was this guy who, looking at, I'm a very safe player, okay, because like I told you, I don't have much confidence. I don't like to venture into things that are difficult to see and foresee. Sorry. And she believed in me so much that she used to tell me, it's okay, don't think about the money. 2-3 lakhs is not a big deal. You can always earn it back. Just give it, because you've always told me about it. You've always given. You've shown that you have the potential, but you're not taking that step forward.
Yes.
So she's probably someone who's really believed in me. Even my parents tell me to be safe. They'll be like, okay, don't venture too much.
Generation, they do.
Yeah, don't invest so much on something.
Yes.
So we invested 40 lakhs on a clinic, which my parents were like, buy a second-hand clinic. You're going to get deaf patients for sure. But me and my wife, we decided to go invest in such a big place and such a risk, right? Entire thing was borrowed, and by God's grace, it's going on well. But I feel it's my wife's motivation. So you need some positive people around you. I feel the number one thing is the positive people around you, either physically like your wife or your parents or your friends, or virtually like your well-wishers on social media, like you guys.
Correct. No, I completely agree. Dr. Kritika has something in her. I also connect really well with her.
No, she's she's a natural motivation speaker. In fact, that's her passion, she wants to always be a motivational speaker.
Yes. No, she's great. So I also always love talking to her.
Yeah.
So thank you so much, Dr. Praveen, for help us understanding about what keeps you going. What is it that led you to give this examination? And great to know that now you're actually helping students to guide them on the right track if they want to clear this examination. So if you are interested, if you're a BDS or an MDS, want to understand what is this kind of examination that can help you to upskill with your clinical as well as theory parts, do connect with him. He's available on Instagram at MicroSmiles. or is there any, or I can also
Facebook.
share his email ID with you. So
I think Facebook I'm more active. So Microsmiles, we have a page called Microsmiles on Facebook. I put almost all my updates there.
Okay, so you can actually follow him, see his cases, and in case of any doubts, you can also ask for the email ID. I will definitely let you know. Or you have any doubts, anything, he's always there to answer you related to all the examinations of Royal College of Surgeons. Also, if you want any guidance with your career, do follow us on our Instagram as well as YouTube channels as well. There you can find all our old videos that can also help you with your career growth. Thank you so much, Dr. Praveen. Thank you so much, everyone, for joining at this time. Have a nice day. Bye-bye.
Thank you, Aishi. Bye-bye.